Understanding the financial quotes for plastic surgery in the independent sector can be confusing. It's required for all quotes to be given as a breakdown before they are accepted by yourself. And we also have to be transparent about where your finances go when you have a surgical procedure. When you receive your surgical procedure, you will receive 2 or 3 figures. The surgical fee. One figure will be the surgical fee. This is a fee that the surgeon will receive and will include, for most cases, the post-operative appointments in clinic after the surgery. The number of post-operative appointments will be specified. Hospital fee. The next fee is likely to be the hospital fee. This is a fee that the hospital receives for providing you the bed and the theatre space for your care. Anaesthetic fee. If you are having a general anaesthetic, i.e. being put to sleep, one figure will be the anaesthetic fee. This is what the anaesthetist receives for essentially providing the anaesthetic. Depending on which hospital you go to and who your surgeon is, you may be requested to provide your surgeon with a surgical fee directly, and the remaining fee is given to the hospital. Or, in some cases, you'll be required to give all the fees, the surgical fee, the hospital fee, and the anaesthetic fee, to the hospital that you are having surgery in, and they will divide up the fees to the required groups. It's also important to be aware that each aspect described are independent of each other and set their own standards of fees, so I do not have control over what the anaesthetist charges or indeed what the hospital charges. Post-operative care. After your surgery, you need to see if the following are also covered in the quotes. These are your emergency care, your aftercare, your doctors and nurses' clinic care, and any future potential corrective surgery. Emergency care is surgery that is required in the immediate post-operative period. This may be a return to theatre for a washout of some bleeding. Some quotes may or may not include this. It's likely that your surgeon may include this as part of their package. However, the hospital and the anaesthetist may require extra fees if this happens. Aftercare is very important after your surgery. For some people, this may be 1 or 2 dressings. For others, this may be a few more dressings, particularly if they have an infection. You may be charged as you go along, or this may be included in your care package. Although it is likely that the surgeon fee is covered when it comes to complications in the immediate post-operative care, it's important to double check. Also check about corrective surgery. This may be a correction of a scar or tidy up of surgical procedures. It may or may not be included. Some fees may include treatment of this, but only if they occur within the first year or 2 after the surgery. Therefore, it's important to check with the hospital what the situation is. Depending on what aspect of your post-operative care your financial package includes, this can change the cost of a given surgery and can explain the variations in the cost of surgery. I hope this makes things a little bit more clear for you, and good luck in your decision-making process for having surgery.